Hello, and welcome to our first lecture in our immunity series. Today we'll be talking about innate immunity, or the type of immunity you have when you're born. This will be in contrast to adaptive immunity, or the immunity that you kind of develop as you are alive. So let's jump right into it. So we have basically two different types of immune systems, but that we all like to kind of bundle up and we say, my immune system, right? Like, my immune system is good, I hardly ever get sick, things like that. All right, but what we're really talking about is a collective of organs and tissues and chemicals, and even cells that make up our immune system. It's not just one part, that's why we call it a system. And it's interconnected. It uses our nervous system, our digestive system, a lymphatic system, and even our integumentary system, right? So there's a lot of cool factors happening in our immune system, right? And just to name a few, we've kind of talked about it with our CSF examples ad nauseum. We've talked about how it should be a sterile environment, and our blood-brain barrier is actually what's protecting us from those pathogens. The fact that it is sterile protects us. We talked about briefly in the lab about our mucociliary escalator and how both mucus and the cilia can help form a environment that doesn't let the pathogens attach. Remember, attachment is the first step in both viral and bacterial infections. Okay, and then bile acids in the liver, using our digestive system. These acids will help increase the pH and help dissolve any pathogens. The skin epithelium both makes it so that it's hard to live on because we have also some bacteria living there, but we also shed it. Tears and likewise urine help flush the eyes and the bladder and the urethra from infection. The lysozyme in the nasopharynx, an enzyme that we produce that will destroy pathogens as well, and that's why it's wiser to breathe in through your nose. And then gastric acid makes the pH of your tummy 1, right? And so we have a stomach acid of pH 1, which is very acidic. That mucociliary escalator just dumps it right in there. And anything else that we eat on our food also encounters this acid. Okay, and then obviously peristalsis can also help keep things moving. All right, so we can see here from just this general overview, this very general overview, it doesn't include blood, it doesn't include several things, but these are just our anatomical barriers. These are just our innate anatomy that does this. So in the next slide, we'll kind of go over the full components. If you take these anatomical barriers and combine them with these components, the cells in our blood and our organs, we can fine-tune our whole immune system. Okay, so we have all those anatomical barriers. We have some leukocytes, or white blood cells, or WBCs. Okay, leuko means white in Greek, so we call them white blood cells. Okay, and so lymphocytes, neutrophils, basophils, eosinophils, all those good names you see over there are all types of blood cells. Okay, and their maturation, or where they go to develop, ends up being what they turn out to be. Okay, and then the organs, we have bone marrow, spleen, lymph nodes, thymus, tonsils. A lot of these just kind of act as like localizing places for these pathogens. If we can get them there, we can trap them, we can eliminate them. Okay, we don't want them around in our bloodstream. Okay, so these are our key components of our whole immune system, and today we're going to go over innate immunity for the rest of this PowerPoint. But first, we will talk about two different case studies in this video. The first one is rather lengthy, and the second one is kind of short. So, brief introduction. I want you guys to be able to read these beforehand, pause the video, read it on PowerPoint before I get through it. There's a lot of text on the slides, and that's just straight from the source, so kind of bear with it. Okay, I'll summarize. 25-year-old female comes into the emergency room, can't breathe, can't talk, shakes her head for answers. And then obviously after some time and with difficulty, she explains her dad died at 27, okay, from a similar respiratory attack. Okay, so now, we're getting some genetic causes here already, right? We can already kind of think that, it's hereditary. Let's check that data bank that we have in our head. Okay, so what are some possible causes of constricting and swelling of the airway? Right away, we all think asthma, right? Asthma, you can't breathe, you get your inhaler, opens up your airway, and you can breathe. Uh, you know, um, Insect stings also can do that. Anaphylaxis, okay? So, but we don't think that is what's happening here. Allergies are also another thing. If you eat too much shellfish, people know if you're allergic to shellfish, close up your airways, all that good stuff, okay? What causes swelling of body tissues in general? That's a good question. Remember, swelling of body tissues is called inflammation, and we will discover what causes inflammation in this chapter, PowerPoint. Okay, so she's immediately treated with antihistamines, corticosteroids. Okay, let's get that airway open. The antihistamines will take care of any allergies. The corticosteroids will take care of any stress or any non-allergic swelling and help with that. So any inflammation, the steroids would help with that. Okay, and they do it through an inhaler, and they monitor her, but it doesn't seem to get better. Okay, and a clinician conducts the allergy test to see if anything is actually happening allergically. Okay, and then the doctor says, let's check her blood for cytokines. Okay, remember I said in the lab that those cytokines were the messengers of responses, and we'll kind of see that later on, so don't worry. Sputum sample is also taken and sent to the micro lab, us, for culturing, staining, and to see what is up with it. Okay, so what aspects could be contributing to her airway? Well, we just kind of said it: inflammation, or even allergies, right? She was treated with antihistamines for allergies. Okay, and then the doctor would be interested in the cytokines because some cells, if they are releasing the cytokines, are saying, "Hey, we're in trouble. We're in trouble." Okay, so that's why he's interested. He's like, "Hey, maybe there's something up with that." Okay, negative for all common allergens. Sputum contain no pathogens, no elevated respiratory microbiota. Lungs are fine. Why does she have airway constriction? It turns out she has high levels of inflammatory cytokines in her blood. So her innate immunity is telling her that she has a problem. Okay, the swelling still hasn't responded to the steroids or antihistamines. Additional blood work shows she has mildly elevated white blood cell count, but normal antibody levels. Okay, so white blood cell count means that they're producing more white blood cells because they sense there's a problem. Okay, but the antibody levels suggest that there's not a secondary infection going on, or that there's probably not a pathogen anyway since they didn't detect one. Okay, and then she also has lower than normal complement protein, C4. Okay, so this is the complement activation system that we talked about, that kind of chain reactions itself onto everything. And so she has lower than normal C4, has cytokines, and no pathogen. So what does this reveal about the cause of her constricted airways? That it's likely involved in her complement activation system. So she's probably having either a false attack, or anything that is doing it is making it worse. And so what are the possible conditions that can lead to low levels of complement protein? And, genetics, right? It's either genetics or stress levels, or maybe a pathogen, right? Could be targeting that as a virulence factor. Turns out that she has angioedema, a genetic disorder, like we thought right away, that compromises the function of C1 inhibitor protein. Okay, so if it's not inhibiting C1, then it's telling the rest of the complement reaction to stay active. Right? There's no feedback switch telling it to turn off. Okay? So she's going to have various episodes throughout her life, and she can be treated with some C1 inhibitors. And if you get a timely injection of that, you can prevent the airway from closing, and you can knock down your C1 function in order to eliminate that chain reaction of the swelling in the throat. Okay, so she was diagnosed quickly and treated, and she may experience other episodes, but she can expect to live a normal life if she seeks any treatment. Okay, so yay, we learned about it, and we got to see along the way where she wasn't sick and what could have been the causes along the way. So it's a very good case study. Especially it kind of helps reinforce the complement system that we will talk about in a bit. All right, in case study 2, 27-year-old male enters the clinic with peculiar skin condition, explains that even mild scratches on his skin turn into swollen welts. Okay, intrigued, you recognize this as dermatographia or skin writing, a condition where the skin raises in response to minor pressure. Okay, so how would you diagnose this though, right? We know what happens, but how do you actually diagnose it? So based on what you know about the symptom, what would you prescribe? Okay, so we see inflammation and we see pressure turning into welts. Okay, so to diagnose it, you'd want to do a controlled test where you would scratch or mark the skin in order to see if that turned into a welt. If it does, it's likely going to confirm dermatographia, okay, or skin writing. Okay, and what would you prescribe for inflammation? Antihistamines, right? So it's always antihistamines when you're taking something for inflammation. Okay, most of the time. Okay, sometimes it's steroids, corticosteroids, for instance. But when it's like allergic effect, when you think it's kind of like mimicking an allergy, it's going to be antihistamines. So you explain to the patient that condition is caused by rapid release of histamines from mast cells in response to the physical trauma. Even though the skin is lightly touched, it kind of assumes that it's been, touched immensely. And so as a result, you experience the localized inflammation and swelling, and the antihistamines will manage the swelling. Okay, and it can last years or even be lifelong, but it can improve over time. So 2 good case studies here, and they both kind of highlight what our innate immunity is doing for us and where it can go wrong. So stay tuned for the next videos for the rest of our innate immunity chapter.